Good morning, everyone. My name is Doly Begum, and this is my first time doing a press conference as Deputy Leader, so I would like to first start with a land acknowledgement. We acknowledge that the land we are meeting on is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. As settler, we also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. And I think we need to go a lot more deeper in terms of land acknowledgements. But I'm proud to be able to recognize, and as an immigrant daughter, to be able to stand in this space and call this place my home. I'm also honored to be a deputy leader of the official opposition. I'm here today with the other deputy leader, Sol Mamakwa, from the riding of Kiwitnang, and our interim leader, Peter Tabuns. The budget that Premier Doug Ford tabled just a few months ago was not good enough for 60% of Ontarians, and we have seen that just a few weeks back. And we're here today with a mandate to make sure that we hold this government accountable, and we propose the concerns, and we propose the solutions that people of this province deserve. And we have new and big problems to deal with, especially now. The hospital staffing crisis has people laying on the floor in the ER. We have gone from hallway medicine to laying on the floor in the ER. Or our waiting days to be admitted, the fact that you have to be waiting to be admitted to the emergency. For many, it's meant rushing to a hospital only to find the doors locked and the lights out. Closures are impacting small communities from Red Lake to Perth. And it's impacting cities. Toronto's ICUs are stretched beyond capacity, and Kingston has led to cap the number of patients it can see at its urgent care center, turning people away. This crisis will not be solved with the budget the Conservatives tabled in April. In fact, that only will continue to worsen this crisis. I would like to pass on to Sol Mamakwa, our Deputy Leader, for the rest. Thank you very much.
Miigwech Doly, thank you. Minigijiga, it's a good day. I know that, healthcare, the health system is in crisis. For example, I know that obstetrics in Red Lake, in my riding, extended their closure. I know that in Sulikout, Miniawan Health Center has 70% of the nurses are agency nurses. I know that to be able to utilize the emergency rooms, we are utilizing a lot of locums. That is not sustainable. I think the cost of doing nothing, the cost of being complacent in the health system will cost, leads to unnecessary suffering. It will lead to needless deaths. We are in a healthcare crisis. I want to say also that since the Conservative industrial budget was tabled, we know that the inflation has exploded over to 8%. For the government, that means their budget needs to be adjusted to account for the inflation, as I said, in healthcare, but also in education. For people in Ontario, it means inflation is, eating away at our paychecks. People in Ontario are finding it harder and harder to stay ahead of the bills and to buy groceries, to make credit card payments, and to keep the gas tank filled. We know the media stories, the reports tell us that corporations are also using inflation as an excuse to making bigger fortunes off the people in Ontario. we need to take new action to give people relief. We need to take action to give people of Ontario hope. We know that billionaires and big box corporations don't need any more of the government's help. Instead, the people in Ontario need a budget that gives people in Ontario, the working folks, and the vulnerable people a hand up. Miigwech.
So, good morning, everyone. Bonjour tout le monde. Thank you, Doly, Saul. Challenges facing working families are not small. People are paying too high a price right now, and in more ways than one. And it doesn't have to be this way. When the legislature resumes, the official opposition wants Premier Doug Ford's Conservatives to table a new budget, one that deals with the healthcare crisis, with exploding inflation, and with more. The throne speech and the budget are the opportunities to give people the hope and the relief they deserve. We want the throne speech and budget to take action to end the hospitals crisis, including scrapping Bill 124, lifting up wages, fixing working conditions, accrediting tens of thousands of internationally educated professionals, and launching a hiring and training blitz to start right now. We want to lift wages up for healthcare workers, teachers, education workers, other public employees, to end Doug Ford's low-wage policy and instead set a precedent of wages that actually keep up with inflation, which is something that working people across Ontario desperately need. We're calling on the Conservatives to introduce real accountability for companies that price gouge and to reverse the cuts to our kids' schools so they head back to smaller classes with more help from caring adults as they recover. We're calling on the Conservatives to include permanent paid sick days in the throne speech and other efforts to protect people from COVID, including better ventilation in schools and all public buildings. And we want Doug Ford to reverse 4 years of cuts to climate action, because it's our responsibility to provide our children and our grandchildren with a livable future and to deal with the crisis that's making its felt today. We're running out of time to take on this issue. People are simply paying too high a price right now. The Conservatives' choices are costing us too much. It's time for a new budget to deal with the new realities. Our official opposition team is strong. It's ready. We're coming back into the legislature Monday reinvigorated and ready to fight for what's right. Thank you. We'll take any questions that you have.
Peter, do you think the honeymoon's going to be short for the Tories? I mean, and on June 2nd, they won more seats than they had. You guys lost seats. You lost 10 percentage points on popular vote. So it was a drubbing for you guys, not as much as it was a drubbing for the Liberals. But the Tories have been reelected. But how long do you think this honeymoon period is going to be? Or do you think it's already over?
Well, I would say that it's already over. I would say that the crisis and emergency rooms across Ontario has said to people this government's policies don't work for them. I would say that people are getting hit hard with higher prices. They don't think the government is looking out for them. Everyday life is getting harder for them. And so I would say that, yes, the honeymoon for a government that, I'll remind you, didn't get a majority of votes in Ontario, still got a majority, I won't argue that, but the majority of people in Ontario didn't support them. It's a government whose honeymoon, I think, came on June 3rd.
But, I mean, first past the post, the NDP formed a government with even fewer, a majority government in 1990 with 38% of the vote. So, I mean, that's the system that we have, right?
No, fair enough. I'm just saying, if you're asking if their honeymoon is over, 60% of the people in the province weren't thrilled with them on June 2nd. And again, with the ER crisis, the cost of living crisis, the love is getting ever thinner.
Can you talk about who you're going to be supporting for Speaker and why?
Who we're going to be supporting for Speaker?
Yeah.
I'll be voting for the existing Speaker.
Okay.
I think he's shown himself to be fair and unbiased in his dealings with the House.
Is the whole caucus, are you asking the whole caucus to vote the same way, or are people free to vote?
Well, people are free to vote as they will, but I think most of us have had an experience with the current speaker in the past.
You wouldn't like to see a woman to be the speaker for the first time? It's the only job in Queen's Park that's never been held by a woman, is the Speaker of the Legislature.
No, that's fair enough. And there was a woman who ran for position of Speaker 4 years ago, not supported by the Conservative Party at that time. As you're well aware, we were threatened by the House leader to vote in a particular way, and we don't take well to being threatened, and we think that it would be good to have a woman as a speaker, but perhaps another woman at another time.
Peter, you're heading an opposition that faces a government that was essentially elected on a pretty immediate platform to pass their budget. They didn't have a larger platform than that. How does that affect your job as opposition over the next 4 years when there's not this series of promises going forward? Does that make your job harder, or how do you really plan for that when there's not much of an agenda that they were elected on?
I think for us, the central point is, how do we defend people in this province from lives that are getting harder? And how do we defend against a government whose actions are making that life harder? And I think that's going to be the guiding star for us. Does it make life better for people, or does it make life worse? Does it put their future in jeopardy, or does it give them assurances of a solid future? And we'll set aside their platform and set aside the election results. We're the official opposition. Our job is to protect the people of Ontario, and that's our intention.
And I don't know the exact number off the top of my head, but there's a good number of individuals in your caucus who have expressed some interest in running for leader. How are you going to manage that until the leadership campaign is over with? You have a smaller caucus than before. Presumably, the members who are running won't be, will be a little preoccupied. So, how do you maintain strength as opposition with that going on as well?
Well, it will be interesting to see how many do declare. As you may know, when we had our leadership rate in 2008, I think half the caucus was running. You were there for that.
It was a smaller caucus.
It was a smaller caucus, yeah, but still, it was half the caucus. The expectation we have is that the majority of members are not going to be running for the leadership, and that they will be focused on taking on this government. And yes, there will be a number who will be running for the leadership. I wish all of them well. We are going to try and operate in a way that is fair to all of them. But our primary focus in the House is going to be making sure that people of Ontario are protected. And I think that's what the leadership candidates will want as well. And frankly, what they are going to try and demonstrate, that they are capable of defending the interests of the people of Ontario.
So you made up your mind about if you're running or not? No, I haven't. Okay.
Doly, have you been considering it?
Peter, got three out, so that means 28 to go. I guess Andrea's not, so 27.
Yeah, you can just go, make phone calls and go through.
Speaking of Andrea, what's the plan there for your party to replace her when she steps down with candidates?
Well, we don't get to call a by-election, but we expect a by-election will be called, and there's already interest in Hamilton and running in Hamilton Centre to replace Andrea. I think we'll have strong candidates coming forward, and we'll have a strong candidate when that by-election is called.
But she hasn't stepped down as an MPP yet.
She has not yet. But I assume that she will to run. So when that happens, then the clock will start to tick on a by-election.
And if the government moves forward with its strong mayor's proposal, I'm sort of wondering if you can give some idea of how your party is going to approach that.
Yeah, we're going to look at exactly what proposal is brought forward because there are a variety of analyses that have been done over the years as to strong mayors. I don't think particularly a situation where a mayor has veto power over a council and has dramatically greater powers that flow from the province is going to improve civic government in Ottawa or Toronto. I know it was 2005 that there was a panel on the restructuring of civic government in Toronto, and there were some things that were put forward around a strong mayor that may have been useful. We're going to have to see what they bring forward. One thing, though, I would advise them to do strongly is consult with the public. This wasn't part of their election platform. There seems to be an interest on the part of the Premier in messing in Toronto elections. And I think we would be well served if he'd actually go back to square one and sit down with people, sit down with Toronto civic government and say, what problems do you have? Are there things around governance that would actually make things work better in this city?
Should this be exclusive as well to just Toronto and Ottawa?
Sorry, you're right. Ultimately, you have to sit down with all the municipal leaders, but because the discussion so far has just been focused on Toronto and Ottawa, at a minimum, you should be talking to the people in those cities.
Peter, you mentioned Bill 124 is one of the focuses in this session. You had very little headway with it in the previous one, and this week when we were speaking with Premier Ford, he seemed to suggest that that was a Band-Aid solution. So what are you going to do that's different to actually maybe have an effect on that?
Well, I would say Bill 124 has become not only a huge problem in terms of driving people out of the healthcare sector, it's a demoralizing force, but it's also become just a symbol overall of this government's attitude towards healthcare workers. The fact that he has not scrapped the bill sends a strong signal to healthcare workers that you don't matter. And I think that's part of the problem we have with retention right now, as well as recruitment. A very clear signal from the provincial government that we will say all kinds of nice things about you, but in the end we're not willing to put dollars on the table that make life better for you. I think the healthcare crisis isn't going to go away. It's deepening. And he is going to have to take steps like scrapping Bill 124 if he wants to have any hope of actually stabilizing the system and bringing it back into the shape that people in Ontario need and deserve.
Bethlehem Favi's budget had a $20 billion deficit on April 28th. Do you think that in light of the health crisis and other things that if the deficit is larger than that, so that more investments are going to things like healthcare or education, would you guys could live with that in opposition?
I think for us, you've got to solve this problem. And I think for the people of Ontario, the demand is there to solve the problem. So if he's willing to actually spend the money to solve the problem, I think he'll get public support. If he says, I'm going to spend this much money, and again, underspends, doesn't even spend what's budgeted, and the problem continues, that's profoundly problematic. And as you know, often they overstate and underspend, and that just deepens people's cynicism and demoralizes healthcare workers.
Peter, you touched on a little bit about paid sick days. I'm just curious as to why the party is asking the PCs to implement, to ask the government to actually pay for those sick days, because the federal government, their paid sick day program essentially asks employers to actually pay for their employees for their sick days. Wouldn't that be easier to ask the government to really read legislation to force employers to pay for those sick days? Why does the government have to pay for them?
Well, we think that the 10 paid sick days should be paid by the employer. I think in the past we've said, okay, if you're only going to give 3 paid sick days and the only way you're going to give it is to have the provincial government ante up, well, then that's better than nothing. But ultimately what I believe that you need are 10 paid sick days paid by employers. Did I misunderstand your question?
No, it's just because the party for the past, even previous press conferences, have been asking the provincial government to pay for sick days. Even with the 3 paid sick day program, that's on the WSIB to actually pay employees for their sick day programs. So I was just curious as to why, because you're asking for not only for it to be extended, but also for it to be permanent. So I'm just asking as to why the party is asking the provincial government to pay for it instead of employers.
Well, I think the employers should be paying. If I've made an error, I will get back to you after this press conference to give you more information. Sorry. Other questions? Okay. Thank you all for your time. Much appreciated.